Welcome, everybody, and thanks for joining us for this Ask a Radiation Oncologist session focused on facts about radiation therapy. My name is Dr. Christian Okoye, and I'm a radiation oncologist at Mercy Medical Center, and I'll be moderating this session. Today, we hope to answer common questions about radiation therapy and give you facts you need so that hopefully we'll dispel some of the myths about radiation therapy. We have a panel of radiation oncologists who will work with me to answer some of these questions so that we can give you the facts and hopefully you'll have a little bit more information than when you started. With me today is Dr. Niu Sanford, a radiation oncologist specializing in GI cancers at UT Southwestern Medical Center, and Dr. Onyinye Balogun, a radiation oncologist specializing in breast and GYN cancers at Weill Cornell Medical Center. We are members of ASTRO, the American Society for Radiation Oncology, and an important part of ASTRO's work is to provide people with cancer, and their loved ones accurate information about the best ways to treat cancer, including radiation therapy. ASTRO has a patient education website called RT Answers, where you'll find videos, fact sheets, and resources about cancer and their treatments. We'll give you more information about RT Answers at the end of our session. For now, I welcome all of our panelists, and let's begin. So today, we'll start with the agenda, and we will talk a little bit about treatment options for cancer, an overview about radiation oncology and radiation therapy, common questions about radiation therapy, and we'll talk a little bit about the RT Answers website and educational materials.
Great.
Just so you guys know, today's discussion format only, and we're just discussing it with our fellow radiation oncologists here, and it should not be used in place of specific recommendations. Please talk to your doctors and your medical professionals about your specific cases. We will discuss all different treatment types, including surgery and chemotherapy, among others. And again, we encourage you to talk with your specialists about your specific care. So we'll start with treatment options for cancer. So I guess we'll start with you, Dr. Sanford. What kinds of doctors are involved with patients with cancer?
Do you want to just mute yours? Okay, so I guess broadly speaking, when we think of the three pillars of cancer care, there's surgery, chemotherapy or systemic therapy, and radiation therapy. So usually a multidisciplinary team would be comprised of those three specialists, which would be a surgeon, a radiation oncologist, and a medical oncologist. And sometimes there are additional specialties involved depending on the specific disease site and the type of cancer, but those are the three main types.
Okay, thank you. And Dr. Balogun, which types of treatments are offered by which types of physicians?
So when we talk about surgical oncologists, they're the ones who are responsible for resecting or cutting out the tumor. And then when we talk about medical oncologists, those are the individuals who are responsible for giving things like chemotherapy and other drugs you may have heard of, like immunotherapy. So they're involved with giving, medications and overseeing the course of someone's care. And then, of course, when you talk about us, the radiation oncologists, we're the ones who are responsible for giving radiation.
Perfect. Thank you. So back to Dr. Sanford. So does everyone get radiation therapy, chemotherapy, and surgery, or how do people decide?
So the short answer is no. Some patients get all three, and some patients get one type of treatment. And so I guess we should back up that each of these treatments have different purposes. The goal of surgery is to remove the cancer. It's probably the easiest to understand. The goal of chemotherapy or systemic therapy is to go throughout the whole body and to both shrink the primary tumor, also to address any microscopic disease or micrometastatic disease. Whereas radiation is more like surgery in that it's a local treatment, but can cover a larger area. And the goal is either to shrink the tumor or to get rid of it completely. So, yeah, going back to your question, does everyone get all three? The answer is no. And it really depends on if we need all three of those types of treatments to optimally either cure or palliate the cancer.
I think that makes a lot of sense. Thank you. So, Dr. Balogun, so when we talk a little bit about radiation therapy, broadly speaking, when we talk about radiation, what does that mean when we say radiation therapy, and how does that work?
So I usually try to explain this concept, saying that radiation is like energy. Think about maybe X-rays, but not quite. And so it's invisible. It's energy that travels into your body, and what it's doing is it wants to damage any cancer cells that are in that area. So there are your body is made up of DNA, right? There's lots of DNA in your body, and these cancer cells also have DNA. So what this energy that's traveling into your body is doing is it's trying to damage the DNA of the cancer cells so that they no longer are able to divide and to grow. So that's how I describe radiation. Energy that's invisible, sort of like X-rays, but a little bit different.
Perfect. Thank you. And Dr. Sanford, so how often is radiation therapy given typically?
Okay, that is a great question. So historically, the treatment was given in small doses every day. That's what we call conventional fractionation. And the rationale behind that is that giving a large dose would be very toxic to the normal tissues around the target. But by giving a small dose, the normal tissues would have time to repair between the treatments, but the cancer cells, which have defective cell repair mechanisms, would die. So that's really the rationale behind giving the small dose per fraction. So I would say daily radiation in small daily doses is still used, but there are now other fractionation regimens. One that probably folks have heard of is SBRT or SABR, stereotactic body radiation therapy or stereotactic ablative radiation therapy. They mean the same thing. And that treatment is based on large doses per fraction, small target areas, and spaced out treatments. So either once every 3 days, twice a week, even once a week. And then some places like our department, I have to put a plug out, is also pioneering even lengthening the duration of treatment even more, like once every 3 weeks or once a month, really with the goal of being able to safely dose escalate by spacing out the treatments so that you can give a higher dose and also making it more safe. So to answer that question, traditionally it has been given once a day, but now there are other treatment regimens that are sometimes used.
Perfect. And actually, really quickly, if a treatment is designed to be given once a day, is there a reason? Can you, in that case, space it out to 3 times a week or once a week, or do you have to sort of follow the regimen that's given?
Yeah, no, that's a great question. And sometimes people ask, well, once a day, why not 7 days a week? Why not weekends? And I guess how I explain it is that most of what we do is based upon studies of thousands of patients and randomized evidence. And in those studies, those doses were typically given once a day, 5 days a week. So we don't know the efficacy if we do it 3 times a week, or conversely, if we do it 7 times a week. What we typically tell patients is that we like to get at least 4 treatments in a week. There are snowstorms that happen, accidents, things come up. And I also don't want patients to panic if they have something that comes up and they miss one treatment a week. So we try to get 4 a week. If there is a holiday or something, then we'll actually make one up on the weekends.
Yeah, I agree. I know that Sometimes in GYN cancers as well as head and neck, we talk a lot about sort of total package time, which means just giving the entire radiation course over a certain period of time and not extending it too far in order to optimize the outcome. So yeah, I agree with you totally. We're here trying to do our best and doing it each and every treatment. Certainly, if you miss a treatment here and there, it's not going to adversely affect the outcome. However, we certainly want people coming, at their scheduled treatment.
And I should ask, it really depends on the clinical scenario. So just like you said, in GYN cancers and head and neck cancers, there is data that prolonging the treatment time is associated with worse outcomes. So those are scenarios where if a patient is missing a day, we might do a double treatment one day. We might be a little bit more rigorous. Hey, don't schedule that vacation. Sorry, you might have to miss this event because we want you to get the radiation done in 6 weeks or 8 weeks. Other scenarios, if we're palliating a patient, if we're doing something a little bit different and we don't have that data, if it's adjuvant radiation, not definitive, then we might be a little bit more loose and have a little bit more leeway in letting patients take a few more days off.
Yes, thank you. So some common questions and facts, hopefully, that you guys can share with us about radiation therapy. So I'll start with you, Dr. Balogun. Is radiation safe? Does it make me radioactive? And can I be around my family after receiving it?
So this is probably one of the most asked questions. So when it comes to radiation, I like to tell people that we have our origins in 1896, right? That's when radiation was first discovered. So fortunately, what that means is that we have spent a lot of time studying radiation therapy and figuring out what works, what doesn't, what's safe, and what isn't. So any uh, setting that you go to where you're receiving radiation should deliver the radiation safely. We know what doses to give through all the studies that we've done, like Dr. Sanford mentioned, and it should be able to be delivered safely. When it comes to does it make you radioactive, that depends on the form of radiation that you're getting, right? So, for instance, if you're getting, let's say, head and neck cancer treatments using a machine, what we call external beam radiation therapy, or you're getting external beam radiation therapy to a number of different parts, you're not going to be radioactive. You can go home, you can be around your family, you can be around pregnant women and children. Those are the most vulnerable populations that we care about. But there are instances where you will be radioactive and you may have to separate yourself for a period of time and follow the instructions of your physician. And that's usually when we're using something called brachytherapy, which is internal radiation. So with brachytherapy, there are different forms of brachytherapy, but there are specific ones where we are placing radioactive seeds inside your body. So one of the most popular is for prostate cancer, where they take radioactive seeds and they place it inside the prostate. There's a certain period of time where you do have to, be careful with the fluids coming out of your body, with your proximity to other individuals. But I think, in general, most of the radiation that's done is using external beam radiation therapy. And in those instances, you are not radioactive.
Thank you. So, Dr. Sanford, so during radiation, can I work? Can I drive? What kinds of things can't do? And what things should I anticipate not doing during the treatment course?
So this completely depends on the type of radiation the patient's getting and the side effects we might foresee. Um, but just sort of typically, I mean, I tell patients that when they're getting treatment, they should try to stay active as much as they can. I tell patients that the ones that are actually sort of in bed all day and sitting down all day actually are the ones that are the most tired, and to try to keep up their regular schedule as much as they can, not to like sign up for an Ironman and go skydiving and push themselves to extremes, but to try to sort of not be at home, sitting at home all day. Um, so I tell my patients that if they feel like they can, that if they're working like right before they start radiation, then they should try to continue working during treatment. Maybe towards the end, as they start to have symptoms, they might want to cut back, especially if they're taking a lot of pain medication, then it might be unsafe to drive. But they should try to have some sort of schedule. I also tell patients that usually the side effects from radiation are gradual. Like it's not like one day you'll be totally fine and the next day you'll be completely incapacitated. So they'll sort of start to see when, maybe work is getting a little bit more challenging to keep up, and then they can cut back. So the short answer is yes, you can work while getting radiation, and yes, you can drive. Um, but there are different ranges of side effects between different treatments, and for some treatment regimen that may be a little bit more tough to keep up a rigorous work schedule.
And I like exactly what you said, which was these symptoms don't come on all of a sudden. They do come on gradually. You can assess yourself every morning and decide sort of whether you're safe to drive. Because certainly we're trying to cure cancer. We're not, we don't want anyone getting in an accident or something, coming to the session. So please, please, please be careful. Thank you.
And I encourage people to get pampered. This is a good time to a lot of us give so much of ourselves, so let other people help you out. I completely agree with everything Dr. Sanford said. But if some people want to help you out, and you should be able to drive, but accept help from others if they want to help you in that way.
Perfectly well stated. So Dr. Balogun, so does radiation make me lose my hair or does it burn my skin? What am I in for?
Yeah, so regarding hair, I think a lot of people are concerned about that, and rightfully so. It's just hair, but it's not just hair. That's what I saw someone write that, and I like that quote. So the where you are getting radiation is kind of like surgery in that it focuses its effects are most profound usually where you're getting treated. So for instance, let's say you have a GYN cancer, a gynecologic cancer, endometrial cancer, or cervical cancer, and we're treating in the groin area, we're treating the skin of the vagina. Those areas are going to lose hair. Okay. um, but people are usually most concerned about the hair on their head. If we're not treating, your head, you're not going to lose the hair on your head. But those areas, like if we're treating breast and we have to treat your armpit, you're going to lose hair from there. But the hair usually grows back, including if we need to treat, a brain tumor of some sort. We are going to be able, you'll have a bald spot, or if they're treating the whole head, you may lose all your hair, but it should also grow back. Regarding burning of the skin, uh, radiation therapy, it has different effects on different people's skin, and we don't fully understand yet, and we can't fully predict what kind of effect it's going to have on your skin. People are doing that research. We're trying to understand, what genes might be involved, what other factors may be involved in the skin response. But for the most part, people's skin tolerates the treatment well. You'll probably notice some darkening of the skin. That's very common. Some reddening of the skin. Um, Sometimes there are severe skin reactions where people's skin peels. Okay, especially if let's say we're treating someone who's had breast cancer, and we want to give on purpose extra dose to the skin. You'll notice some peeling of the skin then, but we'll always provide you with products to help, heal your skin and help you take the best care of your skin possible. So I usually talk about a peeling of the skin, a darkening of the skin, um, or reddening of the skin. I think everyone in radiation kind of shies away from the word burn, but in most parts, we're not burning people.
Yeah, I agree completely. And I guess the other caveat I think that you sort of mentioned is some people are also getting other treatments at the same time. So, you may be getting chemotherapy at the same time, and that may actually cause you to lose your hair. Um, it's hard to sometimes tease out what's doing what. But in this situation, if you're not getting radiation to your head, the top of your head, it's not what's causing your hair loss. So yes, great answer. So yeah, Dr. Sanford. So can I get radiation more than once in my life, or am I just limited to one time? That's it, and I have to go with something else next time.
Yeah, I think this is a great question. And patients ask us a lot because they are worried that if they get one treatment, they can never do it again. So the answer is it's complicated. Um, s- um, so it depends on where. So if they have a second tumor, it depends on where that second tumor is and the time interval that it has occurred in. So I say that usually when we treat patients with radiation, we don't go with the intent of saving dose to treat later. So we typically give the maximal dose that is safe to try to kill every last cancer cell the first time we treat. So we don't leave radiation dose to potentially give down the line. Um, that being said, if they have a recurrence in another part of the body, then the first course of treatment doesn't really affect the radiation tolerance of a totally different part of the body. So the answer is yes, if it's in another part of the body. Um, eh, but when it's in the same part of the body, then we have to consider two things. Um, Really the time interval in which the recurrence happened. If it really happened very soon after the first treatment, then that one means that the cancer was not very responsive to radiation, probably doesn't make sense to treat it again. And two, if it happened very soon after, that's more risky to retreat it. So we're really considering the time interval of the recurrence and also the location of the recurrence to determine whether or not we can give radiation a second time. And I will say, historically, I think folks were much more hesitant to give re-radiation. There was a lot of concern that would be a lot of toxicity. But now I think people are more comfortable giving second doses of radiation now that we are seeing more patients with metastatic cancers living longer. We have more experience and more comfort doing that. And I would say most of my patients get radiation more than once, do very well with it.
Thank you. Okay, Dr. Balogun. So I've heard a lot about proton therapy. Talk to me about it. What is it, and how does it differ from photon or the regular radiation?
All right. So I think the the first thing to understand is that with the most common form of radiation that's been used is the photon therapy, right? So we're just talking about different particles. These are things that you can't see. I described radiation before as like energy um, that you can't see, and so that energy can be made up of photons or it can be made up of protons. And so we've used photons quite a bit, and protons came on the scene, and the main difference is the nature of how the protons travel. So one of the things that is a benefit, or one of the major benefits of proton therapy, is that protons, when they hit someone, let's say my hand is someone being treated with radiation, and when the protons are directed at a patient, fewer of them are going to travel through the individual, and they'll have less dose on the back end. With photons, you're going to have more dose coming through. So protons are a, they push out the dose a little less, protons. And so that's one of the main benefits that people have found. And so I think, protons had been used a lot initially for people who were already irradiated once. Like Dr. Sanford mentioned, we're now seeing more and more people live longer with cancer. And so sometimes, if it's appropriate, we want to say, okay, well, this person already had one course of radiation here. I kind of want to minimize randomize how much dose is, moving to other parts, maybe protons are a good idea. The other individuals that we think a lot about protons for are children. When we're taking care of children, one thing we're concerned about is their growth. And there are instances where, children haven't yet fully done their matured. They haven't, is it bone plates haven't closed? I don't know the right terminology exactly, but, or growth plates, the they haven't finished growing. And so by giving radiation, to the spine, that area, you might stunt their growth. So one thing we want to do is to use protons so that there's less, splashing of radiation on that spine, so that the person can hopefully have less effects on their growth. Now protons are being used much more often in a lot of different settings. We see them being used for breast, prostate, etc. And I think it's just a conversation between you and your doctor, your uh, medical caretakers, about if protons are right for you.
Thank you. I agree completely. So, Dr. Sanford, so if I have to choose between radiation, surgery, and chemotherapy, what are the benefits of radiation in those situations? Why would I choose to receive radiation?
Great question. So I guess when we think about any cancer treatment, we think about a term called the therapeutic ratio. So that is um, how likely a treatment is to be efficacious, how efficacious is it versus how toxic it is. So you want a treatment that's maximally efficacious and minimally toxic. Unfortunately, no treatment is 100% efficacious with zero toxicity, but each treatment has different trade-offs. And that's going to be very different by different disease sites and different specific radiation regimens or surgical techniques. The best way to decide or to see is through randomized trials data. So the best way to guide between choosing the different modalities is to look at randomized evidence and see what those studies show. That being said, broadly speaking, why would one choose radiation over chemotherapy? Typically, radiation over chemotherapy is chosen when there is one spot to treat, one spot to target, versus chemotherapy goes throughout the whole body. Depending on the type of radiation, the side effects can be less, and usually the treatment time is shorter. And then between radiation and surgery, they're both local treatments. Radiation is typically preferred as a less invasive treatment option. Shorter recovery can allow patients to get on chemotherapy sooner. And also for patients who aren't surgical candidates. So those are typically reasons why someone might choose radiation over surgery or chemotherapy.
Yeah, I agree. Ultimately, like you said, it's very site specific. Talking to your doctors really is the most important part, and sort of getting both sides of the story and making a decision that makes sense for you and your family. Okay, Dr. Balogun. So does radiation make me sick? What, when we talk about side effects, what things can I sort of anticipate?
Yeah, so the side effects you'll experience depend on where we're treating. So for instance, if we are treating, let's say, a head and neck cancer, um, you might notice things like fatigue in general. You might notice fatigue. You might notice changes to the skin, redness and darkening in the area we're treating. You might also notice some difficulty, like pain when you swallow or difficulty swallowing. Versus if you're treating, let's say, a breast cancer, some of the side effects that you'll notice are, one, again, fatigue, skin changes, darkness and reddening of the skin, and also sometimes people might notice there's a risk of swelling in the breast if the breast is still intact. There's a risk of possibly some pain, some discomfort in the breast. So it just really depends. And I think everyone responds differently to radiation. And again, it's difficult for us to predict how you will respond. I've had people who have breast cancer treatment and they sail through and it's like nothing happened. And I've had others who within the first week notice, oh my, I'm really fatigued. So we just make sure that your doctor is going to monitor you throughout your treatment, and we will try and address any side effects that you have.
Perfect. I agree completely. So, thank you guys for taking the time to listen to this. We encourage everyone to visit the rtanswers.org website for more information on the radiation therapy treatments. There you will find an array of information, including brochures, videos, and on a variety of cancers, including new videos with an overview of radiation therapy, questions you should ask your doctor, as well as patient stories from people who've had radiation therapy. Thank you for joining us, and be sure to follow RT Answers and Astro on X, formerly known as Twitter, and Instagram. Thank you.